everyone, it's Dr. Evangeline Obi again. Today I will be talking about primary care. This is a National Primary Care Awareness Month, and I want us to understand what a primary care means. I'm sure you've heard about your primary care doctor, and I sincerely hope, everybody has a primary care doctor. Your primary care, this will be a quick video because I expect you all to know this. A primary care doctor is your doctor. Wherever you go, you'll ask who your doctor is. Your primary care doctor is your doctor. Is that person who knows your medical history. Wake them up and they would know it. It is not somebody you see once in 10 years. It is not somebody you even see once a year, especially if you have chronic disease conditions. Unless if you're young, no medical history, yes, once a year you go get your physical, annual physical, it is called, with your primary doctor. Your primary doctor knows you, your medical history, and sometimes other history that are not medical, but that would help them understand you better, because sometimes what is happening in physical, it's because of what's happening outside of physical that is impacting the physical. So your primary doctor understands you. Sometimes they know your family too, because probably they take care of your children, your husband, your parents, and they know you. They understand the dynamics of everything happening in your life that could impact your health. So a primary care doctor knows you well. It is a long-term relationship. It is not somebody you just wake up and say, oh, I'm going to a doctor. No, it is my doctor. They know you. They just hear your name and everything medical going on with you will go quickly in their mind. They are in a better position to do your physical annual wellness because they know you well and know what you've had and where you are and what you may need for the future, especially in terms of preventive screenings like cancer screenings. When it's time, they will be telling you. When immunizations are due, they will be telling you. Whatever is due for you, they will be telling you. When you're mentally, emotionally challenged, they also know and they will advise you adequately, properly. It is a doctor that knows you, not just medically, but also understands your family dynamics and even your work dynamics and things that can impact your health and address it. They do it quicker, more than somebody who doesn't really know you. Your primary care doctor is not your specialist. You see your specialist, and I see some brag. Oh, I see a cardiologist, I see a pulmonologist, I see a neurologist. Yes, you need them. They are specialists in that one little system of the whole body. And that is what they will focus on. Your cardiologist will not be telling you, oh, your respiratory function is this. Neither will your pulmonologist telling you, oh, your heart valves or heartbeat is abnormal, or this is going on with your heart. They may have some idea, but it's not their area. And sometimes they will not, unless if it's clearly involved in what they are addressing. But your primary doctor, again, is that person who will put all those things together. Your primary doctor would know, oh, you're seeing a cardiologist and this is what they're addressing. You're seeing a pulmonologist, this is what they're addressing. You're seeing a neurologist and this is what they're addressing. A GI doctor, this is what they're addressing. And they can put it together. Maybe your anxiety is the reason why your GI is off track. Maybe your anxiety is why your heart is racing or beating abnormally. Maybe your anxiety is where your respiratory function is going up and down. You're getting a lot of allergies. You're worrying too much. Your primary doctor, again, puts all those together. They are your best advocate, health advocate. They can even reach out to your specialist and get a better understanding of what they are doing for you, or even request that they do more for you, or even ask for a second opinion when they don't think they are doing enough for you. So your primary doctor is that advocate you have for your health needs. Your primary doctor knows when you're due for preventive screenings. Your primary doctor, some of them can see you in the hospital. When you're in the hospital, they can follow through. And if they have some hospital care knowledge, they may even speed up things for you. either prevent you going to the hospital or follow you when you're in the hospital and make sure you're getting the things you need to be done in the hospital. Your primary care doctor can also follow you to a nursing home. If you're there and old and there, or maybe need some rehabilitation, they can follow you and make sure you're getting the care you need, talk to you, explain the process to you, which nobody else may do. Or if they do it, they may not do it well because they don't know you that well. Your primary doctor can also follow you home. If you're old and cannot go to the hospital, they can do home visits for you. They can do video visits or phone visits, or come to your home and assess your home. If you're in a good relationship with your primary doctor and they understand you well, they can meet you at your point of need. That is the exciting thing about being a primary doctor. And that is why I'm in this field as a family physician. We are a family. That's what it should be. We are a family. We know you, we know your family, we know your health, we know your challenges that impact your health. We know the specialists you're seeing. We can advocate for you as needed, and we can meet you wherever you are to take care of your health need. And we know what you need best for preventive screenings, immunizations, and know when to say, oh, you don't need this, or you need that, or this will not be good for you, based on other medical challenges you have. So work closely with your primary care doctor. Make sure your primary physician knows you and that you understand the benefits of having a primary doctor, and that you stick well with your primary doctor and get the best medical care you need. Remember, it is National Primary Care Awareness Month of October, and I wish you all the best. Do what is right for your health, because health is wealth. And whatever is lost, for those who don't see their primary doctor on time and they're already diabetic, hypertensive, cholesterol, some things can be reversed, but some other things cannot be reversed. That's why it's good to start on time. And I especially plead with these young people, especially our men who think they are strong and okay and can defeat anything. No, health things, there are things you cannot defeat with your strength. You have to defeat it with your knowledge, and we're doing the right things by following closely with your primary doctor. Get examined, get blood work done, get your screenings done. And if you're doing all those, yes, then you're truly strong and good. Go see your primary doctor, and if you don't have one, connect with Dr. Evangeline Obi, and you will be well taken care of. Love you all. Bye-bye. Sorry for my voice, but my voice cannot stop me from getting the message across to all who cares to listen and use it. Bye-bye.